Let's talk policy. Anytime I'm starting a discussion of health policy with a new class, one of the things that I want to make sure that that class understands is how we define health. Defining health is essential to understanding how policy is made and why certain groups propose one policy while other groups may pose another. Why do you need to define health before you begin your study of health policy? The World Health Organization said that better health is central to human happiness and well-being. It also makes an important contribution to economic progress as healthy populations live longer, are more productive, and save more. The question to you is this why you need to know how to define health? Well, the short answer is no. The reason you really need to know how you define health is because it influences your perspective of the topic of policy. How you define health is going to impact the policy that you think will be most successful, the one potentially you think is the most feasible, or better yet, the one that will accomplish the goal. Let us begin with a few definitions of health policy. The World Health Organization stated that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It can also be defined as a dynamic state of well-being, characterized by physical and mental potential, which satisfies the demands of life commensurate with age, cultural, and personal responsibility, or a condition of well-being free from disease or infirmity, and a basic and universal human right. And finally, a state of physical and mental well-being necessary to live a meaningful, pleasant, and productive life. All of these definitions have similarities and they have differences. One specific difference is whether or not health is a basic and universal human right. I think that the majority of people believe that it is a basic and universal human right. Yet I know people that want to put many, many limits on what that means. And hopefully, by the end of this course, we will examine some of those limits, and you will be able to decide for yourself whether or not it's a basic human right, whether or not it's a universal human right, and how that should influence the policy that we make. Now would be a good time to pause the recording and take a few minutes to define health for yourself. Think about your practice and your career, your own life, and how you would define health. Because the definition that you already currently believe, and most of you know a definition, you're practicing healthcare clinicians, so you have a definition in your head. You need to decide if that definition is adequate. So take a moment and then come back. Some of the factors that we must consider when we're defining health are the social determinants of health. Now, there are determinants of health that are also important, and determinants of health are things that are biological or genetic that you potentially can't change. So I can't change the fact that I come from a family that has a history of heart disease, or someone can't change the fact that they inherited the BRCA2 gene. Those are determinants of health, but they are essentially outside your control. Now, we can still make policies that help people that are predisposed to genetic conditions, but policy can also impact the social determinants of health. So I've provided this graphic from Kaiser Health that shows Some of these social determinants of health: economic stability, neighborhood and physical environment, education, food, community, and social context, and the healthcare system. Social determinants are defined as those factors contributing to the social welfare of an individual that make him or her more or less vulnerable to disease or poor health status. Variations in health can be the result of socioeconomic differences in smoking behavior, alcohol use, and access to care. Policy should be focused on improving the health of the population, regardless of whether it is health policy or not. We know, for example, that state-level income inequality related to 6 of the 10 mortality rates independent of differences in country income in each state, or county income in each state. Mortality is more strongly related to county median income. This suggests that the factors responsible for the tendency for more egalitarian societies to have better health may be closely related to those factors that account for the socioeconomic gradient in health. Among people of working age, there was a contextual effect of smaller income inequalities that reduced the socioeconomic gradient in health. Recognizing the health effects of poverty is one thing. Taking action to relieve its effects entails a richer understanding of the health effects of social and economic policies. Consider this: measures of health can be rated across several spectrums: infectious disease, infant mortality, prevalence of smoking, violent crime, cardiovascular death, children in poverty, immunizations, and so on. Lack of health insurance also has an impact and frequently results in poor physical health. We know that countries with strong primary health infrastructure have been shown to have lower costs and to perform better in the healthcare arena. Primary care is more effective in preventing illness and death and is associated with more equitable distribution of health. All of this can be impacted by policy. And in many ways, if you look around, even the city we're in of St. Louis, and you go through the city, what you will find is that people have made policies that have certainly impacted the health of communities. You can drive through communities that are essentially fresh food deserts, where there is no place that anybody could go and get fresh foods. Consequently, we know that that impacts health. We know that if you have a failing educational system, that impacts health. So if you look around at the schools that for so long have been unaccredited, that is going to impact the health of the people. Those are policies that we must work on. And those are part of the social determinants of health. Social factors such as education, racial segregation, social supports, and poverty account for over 1/3 of the total deaths in the U.S. The likelihood of premature death increases as income goes down, and the lower the educational levels are directly correlated with lower income, higher likelihood of smoking, and shorter life expectancy. So if we know this, how can we say that educational policy is not part of health policy? And that we must address health disparities, which are the differences in health outcomes that are closely linked to social, economic, and environmentally disadvantaged. Everybody has a vision. So my vision is that we can make lives better by promoting health as an act of social justice. I will admit that to me, this is a passion in life. I do believe that health is an act of social justice. That if we are not trying to improve all of those things that we know result in poorer outcomes in a person's health status, then are we really doing our jobs as healthcare providers? It's not enough that we just care for the sick. We need to try to prevent illness. And if we know the things that make people more likely to become ill, then do you believe you have an obligation to act? To act, you have to understand what drives health policy. I would suggest that there are several things that do definitely drive policy. But first among those are the values of the population, the values of the communities, and the values of the people in the country. In the United States, for example, we know that people prize their autonomy, their right to self-determination, and privacy related to their health decisions. And we also know that there are a lot of people that want to take away all of those things in the name of making things better, or sometimes in the name of their religious beliefs, or sometimes just because they think it'll save money. The reality is that if the majority of the population is opposed to something, the likelihood, the feasibility of it ever happening and becoming policy are slim to none. What we know is that as a country, when we're outraged enough, we find our voice. And in finding our voice, we can change policy. We also know that as Americans, we have a belief in justice and equal access. And we all know that there are people who are highly elite who do not believe in equal access. They believe that their money makes them superior, or their PhD makes them superior, or their good looks make them superior. But the majority of Americans don't think that. They really do believe in justice and equal access. And you will find very few people that say, for example, we should not provide emergency life-saving care to everyone, regardless of their circumstance. The third arm of what drives health policy is the government and the branches of the U.S. government. Before you move very far into this course of study, you need to make sure that you understand the three branches of government and what their responsibilities are and are not. For example, the legislative branch is Congress. It's the one that makes the laws. 435 members in the House of Representatives and 100 members in the Senate. They are different in the number of years they work, how they serve, how they approach policies, and to some extent what their responsibilities are. So you need to make sure that you know them. Every person that's interested in health or health policy should be able to name who their congressperson is and who their senators are. You should email them. You should visit their offices. Try to make sure they've at least seen or heard your name. The executive branch is the president, the vice president, and the cabinet. It enforces the laws. And it is somewhat different. The president is elected technically by all the people. Now, we all understand the reality of how the president is actually elected, and that what you're actually doing is electing the people who elect him or her. But but the fact of the matter is, the executive branch is responsible for enforcing the law. It has the ability to veto laws, which can be overridden, to make treaties with foreign governments, and it nominates members for the Supreme Court. Now, it doesn't have total authority with the Supreme Court because those people then have, there's advice and consent. So they still have to make it through the legislative branch before they can move forward. The third branch then obviously is the judicial branch. It's the Supreme and the federal courts, and it interprets the laws. It does not make laws. It interprets laws. And it has broad authority to interpret those laws. Anyone appointed is appointed for life. They can declare laws unconstitutional. They can settle disputes involving the U.S. The Chief Justice of the Supreme Court presides over impeachment trials of the president if a president is actually impeached. You really do need to understand these branches and how they work. There's a lot of confusion among the population as a whole. It seems like people have forgotten the civics lessons from junior high school or from middle school or from high school, wherever you took it. A lot of people forget this piece. And this is where policy actually is first implemented. So it's a powerful group of people, and you should always try to influence their perspective and make sure that they understand yours. Health policy is authoritative decisions made in the legislative, executive, and judicial branches of government that are intended to direct or influence the actions, behaviors, and decisions of others. Authoritative decisions made in the legislative, executive, and judicial branches. Their goal is to influence actions made by others. They make the laws, they make the regulations, and then those have to carry down into practice. So defining health and making policy, why does it matter? The social determinants of health are mostly responsible for health inequalities. The unfair and avoidable differences in health status seen within and between countries. It's problematic, and it's something that we as a whole need to address. The social roots of health inequalities lie within education, taxation, labor and housing markets, urban planning, government regulations, healthcare systems, all of which are powerful determinants of health and ones over which individuals have little or no direct personal control, but can only be altered through social and economic policies and the political process. Dr. Margaret Chan, who's the Director General of the World Health Organization, stated that social deprivation is not a matter of fate, it's a matter of policy failure. A toxic combination of poor social policies, unfair economic arrangements, and bad politics, and is killing people on a grand scale. If health inequalities are responsive to political and socioeconomic policy choices, then it should be possible to reduce health inequalities by chosen and concerted actions across social determinants of health. You're now driving down a road. It's wide open, and you have the ability to choose where you go. You have the ability to influence how others get there. The better you learn policy right now, the more powerful and the more impactful you will be as a clinician.